A registered nurse is caring for a client with Addison's disease. Which of the following does not represent a symptom of this condition? 1. Hyperkalemia. 2. Hypoglycemia. 3. Purple striae. And 4. Tan skin. So we have to remember that in Addison's disease, the adrenal glands are not producing enough cortisol and often aldosterone as well. So let's go ahead and look at our answer choices. So number 1, hyperkalemia. What does this mean? That's right, high potassium. So this is not going to be a correct answer because hyperkalemia is a symptom of Addison's disease. Remember, our question has a negative stem there and says not. So the lack of aldosterone production leads to low sodium reabsorption and potassium excretion, which leads to those high potassium levels. Now moving on to number 2, hypoglycemia. What does this mean? That's right, low blood sugar levels. And this is also not going to be the correct answer because hypoglycemia is indeed a symptom of Addison's disease. Remember, cortisol is involved in glucose metabolism, and the lack of it can lead to reduced glucose production and hypoglycemia as well. Now moving on to number 3, purple striae. Do you remember what this is? You got it. It's just another name for stretch marks. Are these commonly seen in Addison's disease? No, you've got it. Purple striae are definitely more commonly seen with conditions that involve excessive production of cortisol, such as, that's right, Cushing's disease. You've got it. Okay, now moving on to number 4, tan skin. What do you think here? Yes, this is going to be an incorrect answer because tan skin or that hyperpigmentation is indeed a symptom of Addison's disease. So our correct answer here is going to be number 3, purple striae. So great job to everybody who chose that one. And I just want to give you a test-taking tip. Always read your question slowly, looking for keywords such as not, because that can definitely change your answer. A 16-year-old male is brought to the emergency department with a sudden onset of nausea and right scrotal pain. He describes the pain as sharp and constant. Upon examination, the nurse observes that the right testicle appears swollen and is higher than the left. Which diagnosis should the nurse suspect? 1. Cryptorchidism, 2. Epispadias, 3. Peyronie disease, or 4. Testicular torsion. So by looking at this question, I always like to find my keywords. So here are the ones that stick out to me are sudden onset. Also, I see here we're talking about the testicle, okay? So those are things I'm going to focus on as I go through my answer choices. So looking at number 1, cryptorchidism. Yes, so this does refer to undescended testicles, typically diagnosed in infancy or early childhood, but it is not associated with sudden onset of pain in adolescence. So we're going to go ahead and rule that one out. Looking at number 2, epispadias. So this is going to be a rare congenital defect affecting the placement of the urethral opening. And once again, it is unrelated to a sudden onset of scrotal pain or swelling. Okay, let's look at number 3, Peyronie's disease. Do you remember what this is? Does it have to do with a sudden onset of pain? Does it have to do with the testicles? No, this one has to do with the penis, okay? So remember, this condition involves the development of fibrous scar tissue inside the penis, and it causes curved, painful erections, and it is not related to acute scrotal pain, so we can rule that one out. And lastly here, testicular torsion. So yes, this is going to be correct due to symptoms of sudden, severe scrotal pain, that swelling, and the higher positioning of one testicle, which, what does that indicate? Do you remember? Yes, the twisting of what we call the spermatic cord. And do you think this one's a medical emergency? You've got it. This is a big time medical emergency. Great job to everyone who got our answer right, which is number 4, testicular torsion.